Where do the fibers of the cardiac plexus end up? Most in the SA node, and some in the AV node. What do the sympathetic fibers of the heart do? Accelerate nerves. What do the parasympathetic fibers of the heart do? Inhibitory or depressor nerves. What do arterioles do? Carry blood away from heart. What do venules do? Carry blood toward heart. What do capillaries do? Microscopic connections that carry blood from arterioles to venules. What is the tunica adventitia? Outer layer, fibrous connective tissue attached to surrounding tissue. Thickest layer in veins. What is the tunica media? Middle layer, circular smooth muscle and elastic connective tissue, usually thicker in arteries and veins, allows for vasoconstriction and vasodilation. What is the tunica intima? Inner layer, endothelium continuous with endocardium, forms the cover of semilunar valves in veins and valves in general. What is the function of capillaries? Site of all material exchange. What is the function of arteries? Regulate blood flow increase or decrease. What is the function of veins? Return blood to heart. What is the function of sinuses and sinusoids? Reservoirs for blood. What does systemic circulation mean? Blood flows from L ventricle to all body parts, and back to our atrium. What does pulmonary circulation mean? Venous blood from our atrium and our ventricle to pulmonary artery to lungs to capillaries. What are the systemic veins? Blood from head and neck, upper extremities, thorax, and abdomen drains into superior vena cava via these veins. What are hepatic portal circulation? Veins from spleen, stomach, pancreas, gallbladder, and intestine send blood to liver via these veins. Where does the venous blood from the lower extremities and abdomen drain into? The inferior vena cava. What is a synonym of a zygos vein? Superior vena cava. What does the atrioventricular node do? Slows conduction for about 0.1 seconds before impulse is passed to AV bundle. Crosses fibrous base. What does the atrioventricular bundle do? Increases conduction velocity, forms R/L bundle branches in interventricular septum, passes impulse to Purkinje system. What does the Purkinje system do? Impulse conduction throughout both ventricles. What is an ectopic pacemaker? Abnormal area of myocardium, which becomes the pacemaker. What is an electrocardiograph? A machine used to record heart electrical activity. Provides understanding of electrical conduction across the heart. What does the P wave indicate? Depolarization of atria. What does the QRS complex indicate? Depolarization of ventricles. What does the T wave indicate? Repolarization of ventricles. What does the U wave indicate? Repolarization of Purkinje fibers in papillary muscle. How long does the SA node shower last? 0.1 seconds. How long does the AV node discharge last? 0.3 seconds. What happens during the AV node discharge? Isovolumetric ventricular contraction, ejection of blood into the pulmonary artery and aorta. How long does the ventricular diastole last? 0.5 seconds. What happens during ventricular diastole? Isovolumetric ventricular relaxation, passive ventricular filling. What makes the first sound of the heart? Contraction of ventricles, vibrations of closing AV valves. What makes the second sound of the heart? Vibration of closing semilunar valves. What is a heart murmur? Caused by blood rushing around in irregularity, such as a leaking valve, incomplete valve closure or a stenosis. What happens when there's an increase in cardiac output? Increase in arterial blood volume. What happens when there's an increase in arterial blood volume? Increase in blood pressure. What are some factors affecting stroke volume? Starling's law of the heart: the more stretched the heart muscle at the start of contraction equals stronger contraction, increase in venous return equal increase in stroke volume. What does Starling's law of the heart ensure? That the heart pumps out all the blood returning to it. What does parasympathetic stimulation of the heart do? Inhibitory, result of vagal-mediated acetylcholine release. What does sympathetic stimulation of the heart do? Speeds up heart, result of norepinephrine release at distal end of cardiac nerve. What do the aortic and carotid baroreceptors do? Impulses from both are sent to cardiac control center in medulla, detect increase in blood pressure, results in vagal inhibition slowing heart rate, and causing a drop in pressure. What does the vasomotor control mechanism do? When there's an increase in blood pressure in carotid and aortic arch, impulses to the vasomotor center result in what? Parasympathetic stimulation, decrease in heart rate and blood pressure, inhibition of sympathetic vasoconstriction, results in vasodilation. When there's a decrease in blood pressure in carotid and aortic arch, impulses to the vasomotor center result in what? Sympathetic stimulation, increase in heart rate and blood pressure, sympathetic stimulation of blood vessels and vasoconstriction. What are the vasomotor chemoreflexes? Located in aortic and carotid bodies, sensitive to hypercapnia, hypoxia, and lower pH, sends impulses to medullary vasomotor center, vasoconstriction of arterioles and venous reservoirs, which increase blood flow. What is the medullary ischemic reflex? CO2 and insufficient oxygen to medulla, greater than hypercapnia causes vasoconstriction, thus increasing blood flow. Vasomotor controls by higher brain centers do what? Signals from the cerebral cortex to hypothalamus to vasomotor center, linked to intense emotions of fear or anger. Local control of arterioles means what? Stimulated by locally produced substances when there is a lack of oxygen or too much carbon dioxide, results in vasodilation. What does the antidiuretic hormone mechanism result in? More water reabsorption from kidneys, blood volume is maintained. What does the renin-angiotensin mechanism result in regarding total blood volume? Triggers aldosterone secretion which increases sodium retention with water following the sodium, blood volume is maintained. What does the atrial natriuretic hormone result in regarding total blood volume? Released in response to increased blood volume, resulting in increased sodium being lost in urine and more water following sodium, thus blood volume and pressure are decreased. What are 6 important pressure points? Temporal, facial, carotid, subclavian, brachial, femoral. Congenital heart defects usually happen when? First year of life, major cause of death other than prematurity. What are the factors that increase chance of congenital heart defects? Maternal rubella, type 1 diabetes, alcoholism, PKU, drugs, chromosome aberrations. What are some types of congenital heart diseases? Heart defects, hemodynamic alterations, Status of tissue oxygenation. What is coarctation of the aorta? Narrowing of the lumen of the aorta that impedes blood flow. What is aortic stenosis? Narrowing of the aortic outflow tract, caused by malformation or fusion of the cusps, causes an increased workload on left ventricle. What is valvular aortic stenosis? Malformed or fused cusps, strenuous activity limited, episodes of ischemia. What is subvalvular aortic stenosis? Stricture caused by a fibrous ring below the valve. What is a pulmonic stenosis? Narrowing of the pulmonary outflow tract, abnormal thickening of the valve leaflets, narrowing of the valve, pulmonary semilunar valve atresia. What is patent ductus arteriosus? Failure of the ductus arteriosus to close, allows blood to shunt from the pulmonary artery to aorta. What is atrial septal defect? Abnormal opening between the atria. What are the three major types of atrial septal defect? Ostium primum defect, ostium secundum defect, sinus venosus defect. What is ventricular septal defect? Abnormal communication between the ventricles. What are the most common types of ventricular septal defect? Perumbranous VSD, muscular VSD. What is atrioventricular canal defect? Non-fusion of the endocardial cushions happens in atrial, ventricular, and atrioventricular valves. What is tetralogy of Fallot? Syndrome represented by four defects: ventricular septal defect, overriding aorta, pulmonary valve stenosis, right ventricle hypertrophy. What is tricuspid atresia? Imperforate tricuspid valve, lack of communication between right atrium and right ventricle. What are some additional defects associated with tricuspid atresia? Septal defect, hypoplastic or absent right ventricle, enlarged mitral valve and left ventricle, pulmonic stenosis. What does transposition of the great arteries mean? Aorta arises from the right ventricle, and the pulmonary artery arises from the left. What does total anomalous pulmonary venous connection? Pulmonary veins connect to the right side of the heart, directly or indirectly through one or more systemic veins that drain into the right atrium. What is truncus arteriosus? Failure of the embryonic artery, and the truncus arteriosus to divide into the pulmonary artery and the aorta. What is hypoplastic left heart syndrome? abnormal development of the left-sided cardiac structures, obstruction to blood flow from the left ventricular outflow. What is congestive heart failure? Heart is not able to maintain cardiac output at level that meets demands of body, results from poor ventricular function. What is the Kawasaki disease? Also known as mucocutaneous lymph node syndrome, acute, self-limiting systemic vasculitis that may result in cardiac sequelae. What are the stages of Kawasaki disease? Acute, subacute, convalescent, post-convalescent. What does acute Kawasaki disease affect? Capillaries, venules, arterioles, and the heart become inflamed. What does subacute Kawasaki disease affect? Inflammation of larger vessels. Coronary aneurysms appear. What does convalescent Kawasaki disease affect? Medium-sized arteries begin granulation process. Small vessel inflammation decreases. What does post-convalescent Kawasaki disease affect? Scarring of vessels, thickening of tunica intima, calcification, coronary artery stenosis. What are the 6 possible findings of Kawasaki disease? Fever for 5+ days, bilateral conjunctivitis, erythema of oral mucosa, changes in extremities, polymorphous rash, cervical lymphadenopathy. The cardiac plexus sends fibers through tunica adventitia of the aorta. T/F. False, it does not. The ventricles are empty at the end of the systole. False, don't pump all the blood out. How long is the QRS reading? 0.1 seconds. How much blood is inside the atria at the end of the ventricular systole? The atria is full. How is the atria at the end of isovolumetric relaxation? Full of blood. Where can lymphatic drainage of the legs go to? Inguinal nodes. At which spot does lymph join blood? Subclavian vein. Where do lymphs of the breast drain to? Axillary. Where do you find the highest concentration of semilunar valves in the body? Lymphatic system. When is the ventricular myocardium is oxygenated? Just after systole equal diastole. What is the circulatory pressure at the main coronary artery? Equal to diastolic blood pressure. Where does the hepatic portal circulation receive blood from? all venous circulation from splanchnic area. The left common coronary artery is a branch of what? Aorta. The interior iliac artery is a part of what? Common iliac artery. Hyperventilation causes vasospasm of the lungs. False. Vasodilation. Hypoventilation causes what? Vasospasm. What are the covering layers of the pulmonary artery and aorta? Endothelium. The Vicky relationship is what? Tissue perfusion versus ventilation. How much oxygen you're inhaling compared to how much oxygen is getting to the cells. What innervates the atrioventricular valves? No innervation, just pressure. The Purkinje fibers intercept the what? Septal myocardium. Who innervates the papillary muscles? Maintain tension of chordae tendineae, Purkinje fibers. Who irrigates the papillary muscles? Subendocardial branches of the coronary arteries. What is the role of the phrenic nerve in cardiology? No role. The cardiac plexus located around pulmonary veins is a mixture of nicotinic and muscarinic fibers. False, not located there. The bundle of is splits into anterior and posterior bundles. False, left and right. Superior and inferior vena cava and subclavian veins drop into the right atria. False, subclavian vein drops into superior vena cava first. The epicardium is parietal. False, visceral. The pericardial space is located between visceral and parietal. True. The lymph nodes around the interstitial walls are called Peyer's patches. True. The lymphatic nodes of the head and neck are called the Elema ring. No, Waldauer's rings. Why are areas deprived of lymphatic system have myxedema? False.